IPC is an organization devoted to the treatment of psoriasis, and we have over 100 thought leaders in psoriasis throughout the world. The co-authors and I are part of the biosimilar working group, and we hope to educate dermatologists about biosimilars, which are already approved and in use in many parts of the world. So there are 12 counselors of the IPC that work together on this paper, and we all divided up the work, and we had separate sections that we worked on separately, and then we came together and then we worked on the edit of the paper as a group as well. So biosimilars are drugs that are similar but are not identical to the originator biologic. The basic definition of biosimilars urges the question, how is similarity defined? So in this paper, which is the second in a series of 4 papers, we discuss how biosimilarity is defined on a clinical level. Perhaps the biggest problem related to biologic prescribing is the high cost of these medications, and the signature promise of using biosimilars is that it will reduce costs and increase access for patients. In order to reduce clinical costs in developing these medications, biosimilar trials are designed to have smaller sample sizes and have a shorter duration. Further, not all indications need to be studied. Extrapolation is defined as the ability to use clinical data from one disease state and use this data to have an indication approval in other disease states which were not actually studied. However, the dermatology community may not feel comfortable using this sort of extrapolated data. So for example, you may have biosimilar etanercept studied in rheumatoid arthritis and then have an extrapolated indication in psoriasis without actually having any clinical trials in psoriasis. The dermatologist may not feel comfortable using this biosimilar since they don't know how it's actually going to work in psoriasis, and they may actually prefer to use another biosimilar or use the originator drug. One conclusion is that we suggest that biosimilars and biologic agents should not be interchanged haphazardly. And the reason is because it may be difficult to assess loss of efficacy or side effects whenever you're switching between the two medicines haphazardly. I hope you enjoyed this paper, and thank you for reading.